So I'm happy to be here today with the chance to interview and have a little bit of a brief discussion about the conference. I wonder, as a start, if you could just explain what for you has been the most engaging or exciting part of being here.
Okay, thank you. My name is Mike Mbizvo. I'm actually a country director for the Population Council in Zambia, but I'm also very pleased to be serving as a member of the Board of Trustees for Reproductive Health Matters. So I have attended a number of these conferences, beginning with the first one in Uganda, and really this one is the largest attended conference. And what is unique about it is the participation of young people. There are so many young people who are passionate about sexual and reproductive health and rights, and they've been given a forum. For instance, today they had to share some of their issues, concerns, issues that relate, that affect them. You know, very often we present issues or studies that are based on studies we have done with young people, but this time it's them taking the flag, being in the forefront and talking about what it means to them. What it means to them in terms of rights, what it means to them in terms of pleasure, what it means to them in terms of development, socio-economic development, what it means to them in terms of sexual orientation, the very diverse issues of sexual and reproductive health that this type of forum covers. That really I found very impressive.
It has been very exciting to see the number of young people. I completely agree. We've had so many people coming by our booth, our RHM booth. It's been lovely. Mike, I wonder if you could also maybe just say a few words about the relationship between sexual and reproductive health and rights and family planning. This is the International Conference on Family Planning. What do you see as those links?
So the way I look at it is that family planning or even contraception access is a human rights issue. It's a development issue. People have their rights based on either circumstance. You know, at times we try to say only this one and only that one. People who are sexually active or want to be sexually active, it's within their human right to access a modern method of family planning. So this is where I see the convergence, where I see the coming together of family planning or access to contraception with achieving or fulfilling human rights, achieving or fulfilling some of the development goals, SDGs, achieving some of the ratifications that have been made, whether it's within WHO and other important fora. And that interface is coming together, and it's part of the combination that is necessary. You cannot take one in isolation. It has to be within the combination of our commitment to advancing human rights, accessing family planning.
Thank you. We've had a lot of people stopping by the booth saying, we're so pleased to see a journal here at this conference, and we've had such a wonderful reception. As a trustee of RHM, I wonder if you could maybe say a few words about why it is important for Reproductive Health Matters to be in this event.
I think what makes Reproductive Health Matters unique and important is that it is a bold message that it sends. It represents at times voices that have been silenced. Very often, because of the sensitivity nature of sexual and reproductive health, these issues are not discussed openly. Neither are the discussions backed up with data. But here you have a combination of information that can be used for advocacy, for policy, for programs, underpinned by evidence, and yet very openly. So it's a progressive message which the journal carries. It's a journal that's respected all over. I actually came across this Reproductive Health Matters when I was not yet with WHO. I was actually in a country, in Zimbabwe, when I first met the editor at that time. And I followed it since, and I've always looked forward to reading the journal. So I'm really pleased to see you displaying and coming up with all these covers, the range of, the array of topics which are covered by the journal. That's very impressive. And in fact, it cuts across the life cycle spectrum, in that it caters for young people, it caters for older people, for the single, for the married. It goes across and openly talks about issues of their rights to dignity, their rights to sexuality, their right to sexual and reproductive health fulfillment within not just issues of either morbidity or ill health, but also issues of pleasure. And that's what makes this journal important. And that's what makes me enjoy being associated with this journal.
Thank you very much.
Thank you.